Some of my favorite solutions are the simplest solutions, and I love this approach because sometimes we can overcomplicate a process or a concern so much that we get really involved in the details and we start to miss some of the basics. So when it comes to sperm health, the basics are really the foundation of building good sperm health and fertility. So we're seeing a lot more research looking at the deficiency of one particular nutrient that can actually have a significant impact on sperm quality. And I'm going to dive more into the research and what parameters seem to improve. But I just love this approach because we're talking about vitamin D here very specifically. And if you live in North America, we know the risk of having vitamin D deficiency, particularly in Canada, especially in Ottawa, is much higher. In fact, I see patients where we do blood tests for them to check the vitamin D levels all year round. And even in the peak of summer, we have patients who have very low vitamin D levels. With ethnicities that have darker colored skin, there's a higher risk of having low vitamin D levels. So it's really important to look at this because having low vitamin D levels is strongly correlated with lower sperm parameters. And now we're seeing multiple studies that have observed that improving and increasing the vitamin D levels. So they did a blood test at baseline, they gave vitamin D for a period of time, like 150 days, around there. The studies varied in the length, obviously. And by the end of the study, when they checked the vitamin D levels and the sperm levels again, they see two things. Vitamin D levels have gone up and so has the sperm quality. So for a lot of patients where they're told they have poor sperm health and particularly low sperm motility, and they're told that there's no identifiable cause, we have no idea why this is happening, this is something to consider because a lot of people are vitamin D insufficient, where the level of vitamin D in the blood ranges from 25 to 75, or they can be vitamin D deficient, where the levels are below 25 on the blood test. And treating vitamin D deficiency is one of the most simplest things on the planet. So solutions like this, and where we've even seen in practice, just bringing the vitamin D levels up, and all of a sudden patients' motility goes up 5, 6, 7%, and that's what we're seeing in the research as well. Modest improvements in motility, which can make a massive difference when you're looking at sperm motility, particularly progressive motility. So in motility, we can look at how many total motile sperm cells, but the most important parameter we look at is progressive motility. So how many of those sperm cells are moving forward? They can actually travel through the reproductive tract and help with fertilization and lead to implantation. So that progressive motility is supposed to be a minimum of 32%. That's the World Health Organization's reference range, and that's what we use here in Canada as well to measure reproductive capacity and fertility for sperm health. So even if you're at 27, 26%, and a jump in 5, 6% in motility can be fairly significant. Now, one important thing with the vitamin D levels is too much vitamin D can actually become toxic. So that's where we get into what's called hypervitaminosis D. And that can lead to kidney stones, seizures, and a whole host of other issues, calcifications in the arteries and other tissues and organs. So do not just take vitamin D in high doses ever. Always consult with your healthcare provider and always advocate to get a test done, particularly for fertility, because based on where the levels are, we can tell, is there even an insufficiency or deficiency to begin with? Maybe there isn't. But if there is, we definitely want to recheck to make sure that those levels have gone up, and by how much in the next 2 to 3 months after taking the supplement. Because some people won't actually absorb the vitamin D very well, so then we have to look at other routes of administration, or if we need to change the dose or the base that the vitamin D is mixed into, depending on what the carrier oil is. In the supplement, those can all affect absorption. And vitamin D is a supplement that is notoriously known for poor absorption among certain patients or a certain subpopulation there. So vitamin D, very easy thing to check for, an even easier thing to treat for, particularly if you have low sperm motility, low sperm quality. It's not the reason why sperm quality is low or the only solution, but it is one of those missing factors that's rarely talked about and rarely shared.